Hello, everyone, and welcome. Now, we are about to discuss autism spectrum disorders, right? What is important about autism? What's peculiar about this disorder? And some facts that you might see on your test. So, let's go ahead and get all those points, right? Otherwise, this is the reason we're here for. So, let's go ahead and see some characteristics to this disorder that you should be well aware of. So, autism spectrum disorder, what is it? Basically, is a deficit in social communication and interaction across multiple settings. You guys remember when we talked about ADHD, right? Had to be more than one setting. Same thing with autism spectrum disorder, right? So they have a lack of a social skills. Oftentimes, that comes out to be a lack of a social reciprocity. Nonverbal communication, that is, in the most severe cases, problems with developing or maintaining understanding relationship or being friends with others, right? They have stereotypical and gestured repetitive behaviors like hand flopping. They could be doing something like this, head banging, this again in a more severe type of autism, insistence on the sameness, right? They will line up the cars one by one, and they will know exactly which car is in what number in the line, and they are just very specific, right? They like to have a routine, your fixed interest, specific things, and that can be bugs, snakes, whatever. They're very specific, fixed interest, and they can be hyper or hypo sensory input. Right? What else about autism spectrum disorders? Here are the symptoms that are most important about this condition: communication, right? Delayed response to names calling. Hey, Johnny, Johnny, you're next in line. And Johnny just doesn't care. He just doesn't look. Okay. They do not respond by names unless being called by the parents. Babies then stop talking when they were talking before, or just when they should be talking more, they are not. Social behavior, they are loners, right? They miss social cues. Let me tell you something about social cues. One time I had a mild, very mild autistic person. He was an adult, and I finished the interview and he was sitting next to me or in front of me, and I said, okay, okay, thanks for coming, it was great seeing you today, I'll see you next week. And he just stared at me and didn't get up and leave. So they miss the social cues, okay? They simply miss it. They have repetitive behaviors and other physical or medical conditions. As you can see here, uh, they have they have comorbidities with a lot of things, right? Specifically anxieties and OCDs are big ones, okay? Depression often comes along. Okay, risk factors. Males are 4 to 1. So if they have autism disorder, 75% chance it will be a male, right? So that's important fact. They may have intellectual disability and familial history. So it's important when you are trying to diagnose someone with autism disorder, kind of do a family history to see if anyone in a family has this condition, right? It should support your assumption. All right. So some symptoms to be aware of, often reported by parents, is no cueing by age 1. So babies should already be cueing by age 1, not a single word by the age of 60 months. That's not normal. They should be talking a little bit, at least one word by then, but they are not. No response when called by name. No, hey, Johnny, Johnny. And Johnny doesn't look. No response when called by name. Little to no eye contact. You have a conversation and they are looking down, looking sideways, looking everywhere, but eye contact, right? So they have a lack of eye contact. We mentioned about the toys. They are lined up in a particular way or in a specific place, and do not mess with those toys, okay? They have a lack of imaginary friend. We know that having imaginary friend is normal and healthy. However, they have this lack of imaginary friends. They have no interest with playing with others. They are just fine being alone. They have intense tantrum and the short attention span, and also prone to self-injury behaviors. What are the tools, or how can you screen for uh, spectrum disorder? You can use the modified checklist for autism in toddler. So this is important, okay? So think about this. If a question asks which of the tools you can use to diagnose or help you better come up with a close diagnosis for autism, that's what you're thinking, and they say the age is 7 years old, would this to the modified checklist for autism in toddler be the answer? No, that's toddler. So pay attention to this one because this often comes back in tests where we memorize, especially MChat, dot DO DADOSG or ASQ, and we kind of forget what do they mean, and they all three come up in orders for one of the possible answer, and they were like totally missed the answer because we forgot that what MChat is only for toddlers, okay? And so the autism diagnostic observation schedule, genetic, right? The ADOSG is a good one. And you can also use the age and stage questionnaire, the ASD. So understand not only the acronym but the name, so you don't miss it, right? Other ones that you can do, as we mentioned, the MChat is for toddlers between 16 and 30 months. We can use the children autism rating scales, or better known as cars, to help differentiate from other developmental delays. That's a specific one as well, right, that you should know. We mentioned the ADOS, which is the autism diagnostic observation schedule, which evaluate um, all ages and is considered to be the gold standard of assessment. So we just said the gold standard. All right. So you need to know ADOS. Okay. It's for all ages and is considered the gold standard. ADOS. You can do a magnetic resonance imaging. However, not very often used. Is more so to rule out other things. And you also can do a EEG to check for seizures activities. But ADOS, the cars, and the MChat, you should memorize this and put on your book, on your notes. Now, what is the treatment for autism spectrum disorder? Well, there is no cure per se, but we have some medications that may help. And we can consider antipsychotics are effective for symptoms such as tantrum, right? Aggressive behaviors, and prevention of self injury, hyperactivity, and stereotypic repetitive behaviors. The choice here that are often used is risperidone. So risperidone also is an antipsychotic and it can help with aggression, tantrum, and prevent self-injury behavior. So write this down: risperidone or another antipsychotic like Abilify. Okay, so let's do a check on learning. We have a 4 years old boy shows no interest in playing with other children, only interacts with his parents. Spends hours lining up his toys and rarely uses speech to communicate. He often fails to respond when called by name. His physical examinations results are normal. Which of the following condition is most likely responsible for these symptoms? Is it A, obsessive compulsive disorder? Is it B, Rett syndrome? Is it C, autism? Or is it D, Tourette's disorder? Okay, so as we can guess correctly, this is the autism spectrum disorder. The children's symptoms closely align with autism, including the limited social interactions, communication difficulties, and repetitive behaviors, right? We have A, obsessive compulsive disorder. This condition is characterized by repetitive behaviors as well, but communication issues and social difficulties often are not part of the obsessive compulsive disorder, right? Tourette's that we are about to see in this later on this module is a condition that involves involuntary tics or vocalization. In fact, it's two motor tics and one vocal, which are not mentioned in this scenario, so we can throw that out. Rett syndrome is a generic condition and is more common in girls. So we said that autism was more common in boys, so you should know that Rett syndrome is more common in girls. Typically involves a significant impairment motor functions, which is not present in this scenario, right? And Reddit, think about as deceleration head circumference measurements. Okay, so this was a quick video on autism spectrum disorder. I'll see you on our next training. My name is Dr. Lopez, and I can't wait to see you become board certified. See you later.